Hello, I'm Ronnie Squires, and I'm with the Area Agency on Aging in Southeast Arizona. And we're going to be talking with you today about advanced healthcare planning in the time of COVID-19. My role with the agency is Community Education Coordinator. Let me share some visuals with you. I want to give a shout out to the David and Laura Level Foundation, as well as the Arizona Community Foundation, to make this presentation possible. Let's talk about planning. So today we're going to talk about advanced healthcare planning, not financial planning, although that's important too. I want to just start off by saying I know we're living in very challenging times, and that it can be difficult because so much seems to be out of our control. And so with doing some advanced healthcare planning, it helps to bring a bit of sense of control back into our lives. So that planning can be a gift to you, also to your loved ones, as well as your healthcare team. I want to talk about some guides that are available, because a lot of times this topic can be hard for people to broach, and we want to be able to make it easier. We want to make advanced healthcare planning a lot more easy and user-friendly. So I'm going to be telling you about a couple of guides that will help you if you would like some additional information after you watch this today. So the first one I want to tell you about is put out by the Conversation Project and Ariadne Lab. It's called Being Prepared in the Time of COVID-19. What I love about this guide is that it's a 3-page guide, very short, very easy to use, and it asks some questions. It lays out 3 things that are important to do in being prepared, and then it also asks some questions to get you thinking. You know, what is it that is important to you? The other guide that I'd like to talk about is called COVID-19 and You, Be Prepared, Take Control, and that's put out by Prepare for Your Care. Now, both of these guides, I'm going to give you the website where you can reach the information on this. I will do that at the end of this presentation. The Prepare for Your Care guide gives you also tips on COVID-19 and being prepared, as well as the ability to use a guide that has videos that can help you in doing your own advanced care planning. Very user-friendly. So one of the most important things is choosing your healthcare decision maker. Who would speak for you if you were unable to speak for yourself? And I was surprised to learn, as I went through training on advanced healthcare planning, I was very surprised to learn that over 50% of us will become incapacitated enough that we will not be able to make our own decisions. And so it's really important that we choose for ourselves who would speak for us. And I would like to share with you a video that is just a couple minutes long, and it is, I think, a really excellent video using a little bit of humor. This is also done by the Conversation Project that I'd mentioned earlier, but it uses a little bit of humor in talking about who is a good decision maker for you, and importantly, who is not? Let's take a look. It's just a couple minutes.
Your healthcare proxy, like if you need someone to tell the doctor what to, I just go with whatever the doctor said. I wouldn't want to bother them. They're so busy. Doctors know best, right? Be your healthcare proxy? Sure, I'd be happy to. If I'm in town, check out my Instagram pics from Peru. Wish you were here.
Oh, I can never let you go. I can't even throw plans away. As long as it's got one little green leaf, I feel like carrying a booger to the cloud.
Heck yeah! It's a lot of fun. Let me tell you what decisions your best on. You never let them resuscitate. And if they even try to put you into one of those breathing machines, never. I got this. I totally got this. How can you even talk about this? I can't. I just can't. You're gonna die. No. Oh, wait, did that mean from iFunny? The cat and the children? Oh my gosh. Okay, so the cat like, and then he's what? Oh, wait, sorry, what? Well, honey, you and I have been through so much together. Here's what we'll do. We'll sit down, get a cup of coffee, and you tell me what matters to you.
Well, it wouldn't be easy. I mean, I'd be sad, but I have your back.
Okay, when we went through this really sober, I think I can do that. Let's talk about it.
So you can really see there, let me go back. There we go. So you can really see there what does not make a good healthcare decision maker, or another way of saying it too, if you make it legal, is to make it a healthcare power of attorney. So when we look at the planning of who to choose as your healthcare decision maker, then we come to the point too of, okay, so you've selected somebody. Let's have conversations with that person. You know, conversations really matter. What matters most to you for a quality life? You know, we look at quality and we look at quantity. We're all different. What's important to you as to what you want and what kind of quality life you have and that you want. So I'm talking about, you know, some people, for instance, they want to live as long as possible, no matter what. And that's what's most important to them. They want to live a very long life for as long as they can. And so they'd want to have the doctors and the healthcare team do whatever it took to keep them alive, all life support measures. And then we have people that want comfort care only. They want just to stay as comfortable as they can be, but to allow a natural death. And so they are wanting no life support measures. And then you have people that are in between with that. And so looking at quality, looking at quantity, what's important to you. Some people, spirituality is extremely important, and so they would want to have a chaplain or their pastor or faith leader involved, and definitely want to be talking with them. Some people feel being very independent and being able to care for themselves is extremely important. And so all of these things come into play when we talk about quality of life and what we would want. There is no right or wrong. We're all different. We all have different health. We have all different beliefs. We have different experiences in our life. And so it's important that you talk with loved ones and family, friends perhaps, spiritual faith leaders if that's a part of your life, and also your healthcare team about what is important to you. And it's so much better if you're doing it prior to getting ill, getting sick, because at that time you're so overwhelmed. It's you've got so much else going on, as does your family or your loved ones. Because we're living in the time of COVID-19, it's not like we're getting together in big groups and that sort of thing. So being able to share in new ways, you know, by video call or appointments with our healthcare team via telehealth, certainly sharing by email, by phone, by selfie video, lots of different ways of being able to share and discuss about what matters most. And it's not just about what matters most for you, it also is what matters most for them. And having that conversation, it really is helpful to get that topic out there. And you'll find that as you start discussing it, it can take a burden off your shoulders to know that you have discussed it. So thinking about what you'd want if you were seriously ill with COVID-19, we're particularly talking about COVID-19 today, but this also applies in general, and certainly advanced care planning. Well, let me just step back for a minute. Who should do advanced care planning, healthcare planning? Really, all of us that are 18 years or older. Sometimes younger people think, oh, it's not going to happen to me. I've got many, many years left and such. But with COVID-19, we're facing our mortality more. It's coming up front and center for us. And so, and younger people are also getting sick. But not just that. You know, heck, a young person could get in a car accident. A friend of mine, her nephew became incapacitated after snowboarding and hitting a tree. Thankfully, he recovered, but he was incapacitated and needed someone to speak for him when he couldn't speak for himself. When we look at COVID-19 or in general, people have very specific beliefs about what they want. Some people would prefer to stay at home. Some people would rather go to the hospital. Some people have very strong feelings one way or the other about intensive care. I mentioned also about hospice. I worked for hospice for many years and have found that one thing that we realized with hospice is that so many people wished that they had chosen to have hospice sooner because it provided so much support and took that heavy burden of illness off of their shoulders and the family shoulders to know that there was help available 24 hours a day. And so knowing that hospice can be an option, and sometimes the family themselves or the person themselves can ask the doctor if hospice is right, if they're eligible for hospice at that time. So all of these things are things to consider if you were to become seriously ill. Consider completing an advance directive. And what I mean by that is it's a legal form that you can complete, and you can get the forms free of charge, and at the end of our presentation, I will give you resources for that. So you can do these legally without an attorney. If you have an attorney or choose to use an attorney, by all means. However, you do not need an attorney, and there are forms that are very user-friendly and easy to complete that you could use. So the healthcare power of attorney advance directive is who would speak for you if you weren't able to speak for yourself. And the living will advance directive is what your wishes would be, what is important to you and what your wishes would be. In the state of Arizona, and that's mostly what I'm talking about here because that's where we're located and provide services to help people with advanced healthcare planning as well as many other things. The Area Agency on Aging helps our older Americans with many things. But in Arizona, only one witness or a notary is needed to complete the form and to make it legal. So I always like to stress that a notary isn't required because some people, again, feel like, oh, I can't do advance directives because I can't afford an attorney. I don't want to have to track down a notary. Both of those things you can get around by doing the forms yourself. They're easy to complete, but they do require you giving it thought and talking with your healthcare provider perhaps and your family and prior to actually filling them out and signing them. But you need either, as I said, one witness or a notary to make them legal. Let's talk about some facts about COVID-19. You know, this pandemic has hit the world very, very hard. Many people are getting very sick and ending up in the hospital. In the US, millions have gotten sick and 3.4% of cases have died. In Arizona, I know that our numbers have had quite an uptick in the last, you know, more recently, and thousands have died, 2% of the cases. And when I talk about that, you know, that can change over time, and hopefully as we flatten the curve, we'll see those numbers going lower and lower, and hopefully that percentage will go lower and lower as we get better treatments and get a vaccine. You may be taken to a different hospital out of your local area if you do require, and if you choose to have hospitalization. You know, it may be that you will go to a facility that's not in your local area. Also knowing too, because of the contagiousness of COVID-19, family may not be allowed to visit you while you're in the hospital. Of course, they make other arrangements and they do all that they can, but you know, perhaps by assisting with video chat and that sort of thing. Remember to bring your phone and your charger so that you are able to stay in contact with loved ones. People with COVID-19 may get so sick that they need a breathing machine or a ventilator, possibly for weeks in the ICU, intensive care unit, and they generally cannot talk when they're on that machine that helps them with breathing. At this time, 25 to 50% of those on the ventilators will die. Now, those numbers are improving, but that range, 25 to 50%, Of course, that depends on your age and your health and the severity of your case and all of those kinds of things. So that, it has been frightening for people. Thankfully, in Arizona, there has been enough resources in terms of ventilators to treat all those that are needing those at this time. I want to also say, though, that there is good news when it comes to things that have come out of this time of COVID-19. One thing is most with the virus will recover without going to the hospital. So even though it is a pandemic and lots of people are getting sick, we're learning ways of treating, and then we're also learning ways of staying safe, of using quarantine, using social distancing, obviously using a mask, washing our hands, taking all those matters, using all those different methods to stay safe. And I want to mention how important that is, because our healthcare workers are having to face this pandemic, the pressure for them and the stress at having to see so many people sick and so many people dying. It's very hard on our healthcare workers. And so, making sure that we do all that we can, not only for ourselves, for our family members, but for our healthcare workers as well. People are being very creative in how they've been spending time in lockdown and staying at home and staying safe. And being able to stay connected with loved ones. And so we're seeing a lot more video chats. We're seeing more phone calling, emailing, Facebook, all of these kinds of things. And we're seeing, and I'm hearing from people that they are actually connecting more with loved ones now than they had before the virus. And so that's a really positive thing. Another thing that I want to mention is that workshops are available to help you with completing your advanced directives, or to talk about advanced healthcare planning. And so I want to talk about what some of these resources are. I've referred to them before, but I want to go into a little more detail so that you feel like after watching this that you can either download the forms, talk to your family, talk to your healthcare providers and complete these forms, or perhaps after this video you'd like to get more help with it, and you can use one of these resources here. So the first one I want to talk about is our agency, SEGO Area Agency on Aging. We, you can see our website there, www.sego.org/advanced-care-planning. We have free advanced directives for the state of Arizona that are downloadable in English and Spanish. And we also offer webinars on advanced care planning. You can go to our website there and it'll let you know what events that we have coming up, and you can register for them on our website. You could also contact us through that website if you have questions or would like to speak with someone. The next resource I'd like to talk about is Thoughtful Life Conversations. They're through ASHA, Arizona Hospital and Healthcare Association out of Phoenix. They have a number of resources on their website, including free downloadable Arizona Advanced Directive forms. In fact, we use their forms and they provide education both to the community as well as to healthcare providers as they are educating on both advanced healthcare planning and also on something called POLST, physicians' orders for or provider orders for life-sustaining treatment. That is a medical order that your doctor would write once if you were very seriously ill with or without COVID. This is not just for COVID-19. And so they're doing lots of education on that. Another wonderful resource is the Conversation Project. And I've shown you a video today on Who Will Speak for You. The Conversation Project was the one who had done that. They also have free conversation starter kits that are excellent for having you reflect on what's important to you and talking about who to speak with. They have the COVID-19 guide that I spoke to you about earlier, being prepared in the time of COVID-19, that short 3-page guide that's excellent. And you could actually download that, print it out, and complete it or partially complete it. And then also go into your healthcare provider and discuss those questions with your healthcare provider. The next resource is Prepare for Your Care. They also have free downloadable advanced directive forms in many languages, and they have them for all states. They also have that guide I was mentioning to you that can help you with completing your advanced directives, that has real life video stories to help bring in different situations for you to consider. And the last resource I have on here is the Johns Hopkins University, and that is one place that you can continue to stay updated on the COVID-19 situation. So I hope today that what you have gotten from our video is that there are a lot of resources and help out there for you to do advanced healthcare planning. I want to kind of summarize by saying that it's most important to select a healthcare decision maker, and also to talk with your loved ones, family, and healthcare team about what is most important to you. When you do advanced directives and you have these legal forms, you'll want to share them. You'll want to make copies of them and share them with your healthcare power of attorney, your healthcare decision maker, your family, friends, and healthcare team. When we talk about living will and the what you would and wouldn't want, you know, they on there there are specific things that people can choose that they want or don't want, and you may want to have a little more information about that. The Prepare for Your Care website does have more information, for instance, on CPR, whether a person would want CPR or not, or under what circumstances. If you speak to your healthcare provider, you can get also more information about that. So thank you very much for joining us today. And I want to say, hopefully you feel empowered enough now to take control of some healthcare matters by completing the advanced healthcare directives. And I want to say, if you want more information, you know how to reach us through our website. Thank you so much.